prime-time destination for news and bespoke analysis. It's good to have you again with us. On the show tonight, after 68 days of lockdown and 49 days of unlocking the economy, the COVID-19 data for India shows encouraging results. For a country of the size and scale of India, it's performed better than some countries. The recovery rate is at nearly 63%, and the number of deaths per million population is lower compared to other countries. By all accounts, India seems to be defying the odds. We tell you how and why. Also on the show, the latest on floods ravaging parts of India, plus news and updates from around the world. All that and much, much more coming up over the next 60 minutes. But first, as always, the headlines. Prime Minister Narendra Modi speaks to chief ministers of 7 states, takes stock of the COVID-19 and flood situations, assures all support to the states. India's COVID-19 case fatality rate drops further to 2.49%. Federal Health Ministry says it is one of the lowest in the world. Nearly 700,000 people recover. The number of cases touches 373,000. The number of Prime Minister Narendra Modi's followers on Twitter crosses the 60 million mark. He continues to be one of the most followed leaders on Twitter worldwide. Delhi receives heavy rainfall. The Met Department predicts thunderstorm with rain in the national capital and neighboring areas till 21st July. Flood situation remains grim as major rivers in Bihar flow above the danger mark. And coronavirus cases continue to rise globally. More than 14.3 million cases reported. The death toll crosses 600,000. The US remains the worst affected, followed by Brazil. All right, let me dive straight into our cover story. It's about how India fares better than some other countries when it comes to tackling the COVID-19 pandemic. Now, at a time when most models are failing or have failed, the data coming out of India is not disappointing. In fact, some would say it is encouraging. Now, 2 months ago, some people spoke about a Swedish model that's now being called into question. Others spoke about South Korea and some other countries as models too. But today, many of those countries are staring at a second wave of outbreak. But India offers a different story. Take a look.
As the world battles COVID-19, India is leaving no stone unturned to battle the pandemic. Over 1,43 lakh people have contracted the infection so far globally. Modi government's top priority is on early case detection and saving lives. According to the Health Ministry, 11 most COVID-19 affected countries in the world, the US, Brazil, Russia, Peru, Chile, Mexico, South Africa, the UK, Iran, Pakistan, Spain together reported 8 times more cases and 14 times more deaths than India. The focus of containment strategy remains on house-to-house survey, perimeter control activities, timely contact tracing, surveillance of containment and buffer zones, aided by effective clinical management of severe cases through a standard of care approach. Continuously expanding hospital infrastructure has aided in increased recoveries. The latest testing strategy of ICMR allows all registered medical practitioners to recommend testing. The focused efforts of centre and state and union territory governments on efficient clinical management of hospitalized cases has ensured that India's case fatality rate has fallen below 2.5%. With effective containment strategy, aggressive testing and standardized clinical management protocols based on holistic standard of care approach, the case fatality rate is progressively falling and currently it is 2.49%. India has one of the lowest fatality rates in the world. Under the guidance of the centre, the state and union territory governments have ramped up testing and hospital infrastructure by combining public and private sector efforts. Many states have conducted population surveys to map and identify the vulnerable population, like the elderly pregnant women and those with comorbidities. This, with the help of technological solutions like mobile apps, has ensured keeping the high-risk population under continuous observation, thus aiding early identification, timely clinical treatment, and reducing fatalities. At the ground level, frontline health workers like ASHAs and Anganwadi workers have done a commendable job of managing the migrant population and enhancing awareness at the community level. As a result, there are 29 states and union territories with CFR lower than the India average. 5 states and union territories have a CFR of 0. 14 states and union territories have a CFR of less than 1%. This shows commendable work done by public health apparatus of the country. With Bihar seeing a spike in the number of COVID-19 cases, a 3-member team of experts from Delhi visited the state to take stock of the situation. The Union Health Ministry's multidisciplinary team, headed by its Joint Secretary Love Agarwal, reviewed and coordinated with State Health Department in managing the outbreak in the state.
पटना में जैसा आपको पता है कि 25 अस्पतालों में और 5 मोबाइल मेडिकल टीम्स के द्वारा ये स्टार्ट किया गया है और कल 500 से अधिक लोगों की स्क्रीनिंग हुई और 100 से अधिक लोगों का टेस्ट भी किया गया पटना में और सभी जिलों में इस तरह की व्यवस्था की जा रही है। तो ये जो टेस्टिंग किट्स और स्पेशली एंटीजन टेस्ट के लिए किट्स पर्याप्त मात्रा में उपलब्ध करा दी गई हैं कि जो भी सिम्टोमेटिक लोग हैं वो जहां चाहेंगे, जिस जिले में चाहेंगे, अपने अगल-बगल के स्वास्थ्य संस्थान में टेस्ट करा पाएंगे।
On Sunday, Minister for Health and Family Welfare Dr. Harshvardhan inaugurated a plasma donation campaign jointly organized by Delhi Police at AIIMS in New Delhi. Meanwhile, All India Institute of Medical Sciences will conduct human clinical trials of the indigenously developed COVID-19 vaccine candidate Covaxin from Monday. 100 volunteers between 18 to 55 years of age will be part of the crucial trials. Healthy participants with no comorbidities and without a history of COVID-19 will be selected. People only from Delhi NCR will be able to take up the trial. Corona as well as liver test will be undertaken before the trial. 2 doses of the vaccine will be given and there will be a gap of 2 weeks between both the doses. The vaccine will be administered through injection. The emphasis will, however, remain on safety and screening, with ICMR scientists keeping a constant vigil on the scenario. With inputs from Nitendra Singh, News Night Desk, DD India.
Now, many states in India are battling monsoon mayhem. In Bihar, flood situation remains grim, but Assam is witnessing some respite. More in the next report.
Delhi, along with several other northern states, woke up to a heavy downpour on Sunday morning. Heavy rains resulted in waterlogging in several areas of Delhi. A DTC bus almost drowned due to the waterlogging. There were heavy traffic jams across the city due to the same. Slums and kacha houses were also washed away in many areas. Meanwhile, many areas of Uttar Pradesh experienced light showers. The IMD has issued a red alert for West Bengal, Assam, Meghalaya and Arunachal Pradesh after predictions of heavy rains. It has also issued orange alert for some states. Torrential rains have caused landslides in hilly regions. Rains have wreaked havoc Uttarakhand's Munsiari. On one end, there is a debris falling off the mountains. On the other, water is entering the houses of the residents. Assam saw a slight improvement in the flood situation. However, 25 lakh people from across 2,400 villages of 24 districts continues to remain affected. Floods have claimed 84 lives till now, and 26 people were killed in a landslide, taking the total death toll to 110. The flood situation in Bihar remains grim as water levels in all major rivers are on a rise. A village in Muzaffarpur was submerged due to the rise in water levels in the Bodhi Gandak river. Flood affected 2,92,000 people across 8 districts of the state. Around 11,000 people have been rescued from flood-affected areas. 7 sheltered homes have been established. There are currently housing 2,000 people. 27 community kitchens are being run to provide food to another 20,000 people affected due to floods. Many families have taken refuge in the embankments. The IMD has issued a yellow and an orange alert for Himachal Pradesh in view of the possibility of more rain in the coming days. IMD has predicted heavy downpour for 10 districts of Himachal Pradesh on July 20th and 21st. It has issued an orange alert for it as well. News Night Desk, DD India.
And Prime Minister Modi spoke to the chief ministers of 7 states and took stock of the COVID-19 and flood situations. He assured them of all possible help. In a tweet, Assam Chief Minister Sarbananda Sonowal said, and I quote here, PM Narendra Modi took stock of the contemporary situation regarding Assam floods, COVID-19 and Bagjan oil well fire scenario over phone this morning. Expressing his concern and solidarity with the people, the PM assured all support to the state. Unquote. All right, so the cover story is about COVID-19 situation in India and around the world. Let me recap how India compares to 11 worst affected countries insofar as the COVID-19 disease is concerned. Let's take a look at the graphics we prepared just for you. Now, these are the 11 countries which are the most worst affected countries. The US, Mexico, Peru, Brazil, Chile, the UK, Iran, Russia, Pakistan, South Africa, and Spain. These are the 11 countries most affected by the COVID-19 pandemic. Now, moving on to the next slide we have prepared just for you, and that has to do with how the Indian government and people are performing. Now, this is the world population scenario. We have 11 countries which combined have a population of 1.3 billion. India has 1.38 billion. So the interpretation is that India has more population than the 11 countries put together. The next slide is the population density. 11 countries have a density of 86. India has 464, which is 5 times denser than the 11 countries put together. Now, the third slide we have prepared just for you is about another aspect of this debate. That's the number of COVID-19 cases. Now, 11 countries together have almost 85, more than 85, 8.5 million actually, and India has just about 1 million cases in India. The interpretation is that incidence of cases in India is 1/8 of the total number of the 11 worst affected countries. And finally, we have another case of data for you. That's the number of COVID-19 deaths. Now, the 11 worst affected countries have a total death toll of 3.78 lakh, and India has just about 26,273. Now, the mortality in India is only 1/14 that of the 11 most affected countries put together. Now, next, in conclusion, what we can say is that India performs better than those 11 worst affected countries on the metrics of recovery rate per million population and mortality rate per million population. Now, the recovery rate in India is about 63%. Right, next up, we have another data for you, and this is the more India-specific data prepared just for you. Let's bring up the first slide. That's the case fatality rate. Now, case fatality rate is in India, this is from the previous slide actually, this is the conclusion we have drawn from the previous slide, that India performs better than the 11 most affected countries. Now, moving on to the next slide we have, now this is the case fatality rate. It's defined as the proportion of deaths from a certain disease compared to the number of people diagnosed with the same disease for a particular period. So what does the fatality rate look like for India and some of the states in India? Remember, now India has a case fatality rate of 2.49%. It's among the lowest in the world today as we speak. That's a big achievement for India. Now, as I mentioned, among the lowest in the world, and this is from the Health Ministry of the Government of India. Now, let's look at the progress over the last few weeks. Now, in June, the number was 2.82%. On the 10th of July, it fell to 2.72%. And on the 19th July, it fell further to 2.49%. That's the comparison over the last several weeks. Let's look at the state-wise data. Now, remember, India has 28 states and 9 union territories. That means 37 entities in the country so far. And let's look at the state-wise breakup of those 37 states and UTs. As far as the the states go, 29 of them have a case fatality rate of less than the national average of 2.49%. That's a big achievement as far as India is concerned. And 14 of those 37 have a case fatality rate of less than 1%. And further, if you go into the details, now these are the 5 states and UTs which have zero fatality rate in the last many months. They include Sikkim, Nagaland, Manipur, Mizoram, and Andaman and Nicobar Islands. That should give you a sense of where things stand today as we speak. Time for a very short break here on News Night. When we come back, we'll have guests over for a discussion in our In Focus segment. Keep watching News Night. Don't go anywhere.
Should I wear a medical mask? If you are healthy, you only need to wear a mask if you are taking care of a person with suspected COVID-19 infection. You could wear a mask if you are coughing or sneezing. Masks are effective.
Focus segment where we're discussing tonight. The topic is COVID-19, India fights back. We're joined by 2 very special guests. Joining me are Professor Sanjay K. Rai, Principal Investigator of COVID-19 Vaccine Trial at the All India Institute of Medical Sciences in New Delhi. Also joining me is Professor M.C. Mishra, a former Director of AIIMS. Gentlemen, thank you and welcome to News Night. Let me start with you, Professor Rai. You are the Principal Investigator of the COVID-19 vaccine trial at the AIIMS in New Delhi. Help our viewers understand the status of that ongoing research project on a new COVID vaccine.
Yeah. Yesterday we got permission from our ethics committee. So from Monday onwards, we are going to start the various activities related to this vaccine trial, like registration. Already more than 1,000 volunteers, healthy volunteers, they have registered to us. Yesterday evening, we released the 1 phone number and 1 email ID.
Right.
And we never expected this type of overwhelming response. Continuous phone is busy since yesterday. Almost 24 hours it's busy. We have received 780 emails till now from various participants, and almost 800 messages either through WhatsApp or through SMS.
Right. If I can come to you now, Professor Mishra, our cover story on News Night is about how India's performance in the fight against COVID-19 has been very encouraging. Look at the metrics, for instance. The recovery rate is 63%. The mortality rate is among the lowest in the world at 2.49 case fatality rate. In your estimation, what would you tell people who are skeptical of the numbers? They suspect that India might be hiding the figures or fudging the numbers. Help our viewers understand, what is India doing differently and successfully to break the chain and beat the coronavirus?
Mr. Ramesh, thank you very much, and thank you on your program.
You're welcome.
If we look at 4 months since we have had this pandemic into India, March, April, May, June, now July half, so 4.5 months total. If we include February also, 30th January, we had the first set of cases in Kerala.
Indeed.
In India. And February, we didn't see much spike of cases. March, we started having, and we were doing quite well as regards the positive or infected individuals. But then in March, we all know that our testing capacity was very limited. We were not that much prepared in terms of dealing with the pandemic of this magnitude. So I think the watershed date was 22nd March when Prime Minister called for a Janta curfew. And we all knew that this is a trial run and we'll have soon lockdown announced, and which was announced very quickly after that. And 25th March, we had the first
Right.
lockdown, and then we saw 4 lockdowns in succession, and which actually did very well, and everybody appreciated, WHO appreciated, international community appreciated that. And we were doing quite well until we had problem with the Nizamuddin Jamaat, people coming out in large numbers and spread out in almost every state of India, 17 states, and they hid themselves and they did not volunteer to get tested. So that was one spike we got, and that literally derailed our track record of the COVID. And then towards the end of April, we had this exodus of the migrant labor from
Right.
various states into their own states, which again led to, and the resultant of that, we are still finding that in Bihar, like we are seeing now more cases coming up in UP, in Madhya Pradesh, in Chhattisgarh. This Chhattisgarh was doing well until the migrant laborers started coming in. Rajasthan, for example. So I think that was another problem which we are facing even today. But if you look at the testing capacity now has been increased, almost 1,500 labs are performing RT-PCR tests, and now antigen tests has also been roped in for screening purposes. So from that, and then we prepared, the central government as well as the state governments got opportunity to prepare themselves with the number of beds, hospital beds, number of ICU beds, number of creating COVID care centers. So I think all that time, the lockdown period was utilized for ramping up our infrastructure and actually, and also the medical professionals and others, then the food problem, food distribution, etc.
Right.
Then we started realizing that economy is taking a big hit of these lockdowns. And there is no section of society which has not been affected adversely by those lockdowns from top to bottom. So nobody has been spared. You see, malls are closed, cinema halls are closed, the public transport is closed. So it definitely had its own impact. People lost employment, people had to return to their homes. So income levels of even private hospital doctors, I know that it has dipped significantly because the patients are not coming into the hospitals for elective work or for planned work for the fear of COVID, and doctors are also a little bit apprehensive, not treating patients. So then came telemedicine thing. When Prime Minister also announced in one of the Man Ki Baat program, and that actually boosted significantly the teleconsultation, telemedicine component in India in a big way. And today it has become one of the integral part of the institutions as well as private doctors and others. Webinars started happening, all education, university education, school education on online platforms. So people started adjusting to the new situation. And then naturally through June, we saw the spike of cases every day. Testing capacity has been ramped, and now we see in Delhi actually is doing 40,000 per million testing, which is the highest in the country. Then Tamil Nadu is the next, then Mumbai, and then Gujarat and other states. So what we are seeing today, the number of cases, actually sometimes people feel that it is worrying, but we feel that it is not worrying to see these number of cases, because this is on the one hand, we were saying that our testing capacity is low. So we were not picking up enough cases. Now testing capacity has been ramped up. We are saying that we are seeing so much spike. We will see this spike, but nothing to worry from it, because we have, as your story said and you said, our mortality rate, gross crude mortality rate is 2.5% average.
Right. 2.49 to be precise.
Kerala has the lowest, less than 1%. Most states have the low mortality except Maharashtra, Gujarat, and maybe some other state. Otherwise, most states have very acceptable, and actually Chhattisgarh didn't have any mortality for quite some time. So I think that there have been silver linings here.
Sure.
Now antigen test has been added to the ramping up of the testing facility. So I think it will help in combating this pandemic very effectively now, because we can screen. Because none of the tests have 100% sensitivity or specificity. If you
Right.
look at RT-PCR, it misses out almost 30% patients for various reasons. For collection of sample may not be appropriate. Enough viral load is not there in the nasopharyngeal or oropharyngeal swab, and then the transport of that in the medium when it is taken to the lab, so delay in performing the test. So it was RT-PCR is the gold standard test, but then it has its own limitation with the false negative rates of as high as 30%. Then antigen testing, now it has been added. Again, it is not a 100% sensitive test. We misses out almost 20% in that also. So these tests are complementary to each other. They are not exclusive. They are complementary. And if we continue to ramp up our screening and this testing capacity, I think the objective is that we can separate out those who have infection and those who do not have the infection.
All right.
I think once we are able to do that, the persons who have infection will not be able to transmit disease to others. Average, what we are told, that asymptomatic patients, particularly on the one spectrum, then most sick patients on the other spectrum of the disease.
Right.
Asymptomatic patients on an average transmit the disease to 1.5 to 2 persons. So you can imagine that somebody doesn't know that he is carrying the virus, but he is capable of giving the virus to another person. So then in March, we were saying that only those people who have symptoms will put on mask. But now we have gone 360 degrees, and the mask has become one of the best preventive measure in preventing the infection to be contagious. So I think this is one thing significantly has changed. Then in March, we didn't have any medicine whatsoever. We started with hydroxychloroquine. Then people had doubt, and Mr. Trump mentioned it. So there were a lot of competition for other countries to have it. India exported the medicine. In India also, ICMR came out with guidelines that HCQ can be given to the healthcare workers as a preventive measure. But then gradually plasma therapy was introduced because there was no other medication. And now DCGI has approved these two drugs. One is Feviflu, which is the oral drug, antiviral drug, and another is remdesivir. And also, many of these patients, when they are admitted into ICU, they go into the cytokine storm because of the inflammation, systemic inflammation, and also in the lungs. Right. So for that, there is a very effective medicine, which is tocilizumab, so which is also available. So many lives have been saved by giving these injections. And remdesivir, again, both these drugs, oral drug, rifampicin, and also the remdesivir have been approved by DCGI for phase 3 trial. And now the last thing which we were expecting has been added, where Professor Sanjay Rai is heading the team at AIMS trial, and it is a very encouraging response from public that so many individuals have volunteered to get the testing vaccine, because these are human challenge trials, and where safety has to be assessed first in phase 1 and phase 2 trial. And once the safety has been ensured, in phase 2 we can have little bit of immunogenicity also to see whether any antibodies are being formed. Right. As we have known, whatever vaccines candidates have been tried in USA, UK, and other countries, that in USA or UK, there was this Oxford University, which is the Zydus Cadila. This vaccine was given to 45 individuals, and only 27 individuals formed the antibodies. So I think vaccine is again a huge challenge for all of us. In India, we have two candidates which have been approved by DCGI. One by the Bharat Biotech, in which ICMR and NIV are involved. The other one is by the Zydus Cadila, also is being, human trials have begun. So we all are praying that this vaccine works.